So let me explain to you the importance of MyChart, which is an electronic documentation. So the way to communicate with the doctor in the past would be by physically coming into the doctor's office or by phone, but now an electronical and confidential way of doing this, which is secure and safe, is something called MyChart. Each hospital system and practice has their confidential electronic system that allows the patient to communicate with their healthcare providers. We use the Beaumont Epic MyChart. The information you enter into this is completely confidential. So why should you use MyChart? It allows you to send a message to your doctor, to me, at any time of the day, even after the office is closed. Because if you call the phone line, it has to go to the emergency line, and you really do not have an emergency, but you want to leave a message or ask a question. And it allows for the provider, like me, to respond and also look at the other previous messages and the present message trail between you and the clinic team. And it allows the provider to pick up where the trail stops. So there may have been some questions going on, so this whole information is communicated at one time. And it allows us to get through to our patients in an asynchronous way. What I mean by that is, for a phone call, both you and I have to be available at the same time. With MyChart, you could send me a message at 7 a.m. and I could respond at 7:15 a.m. or 8 o'clock, and we still have completed the communication. More importantly, it allows for documentation. This is key, and prevents message drop-offs. Now, sometimes when messages come through phone calls, they may be either noted on a paper that can be put in a doctor's pocket. I may put it in my pocket and I may forget about it. Or message may not be complete. It may say patient called. The doctor may not know exactly what you're calling for. And I do not have the ability to look at your medical chart anyway with a phone message. I have a little paper in my hand or a phone call. If I'm listening to a voicemail, I'm just listening to it. There is nothing conveyed in it. So phone messages also, if it goes to a voicemail, it may sit around in that particular area until I get to my office, which may not be until the end of the day. So traditionally, when I was in training, my attendings and even my fellowship, I would finish the surgeries, then go to the office, and we would then look up all our messages and then call our patients. So we would be basically calling them after hours, and sometimes it's hard to get through patients. So by the time calls, you may not even be available. So this phone tag game is very common. It's frustrating to both you as a patient and us as providers, and we need to stop that. What I'm most concerned about are medical errors, and this is a problem when phone messages happen. So they may not get to the doctor in time or not at all. So I can give an example from our practice and what one of my colleagues told me. So we had a patient supposedly who had called the office and said she had some dysuria, urgency and frequency, and she thought as though she had a bladder infection. And I never got the message. And what I then found out is the hospital's calling me because she's now in the ER and she has a fever with chills and she had kidney infection and she was getting admitted for IV antibiotics. And when I followed through, and patient said that I left a message at your office. So I asked my office staff, who did she leave a message to? And nobody told me, nobody knew who she left with. First of all, it was unclear whether she had left it with us or with her primary care physician. And nobody in my office knew that had happened. And I have people with me who have been with me for over 10 years. They know the drill. So it's not like these are new people. So somehow, despite that, it got missed. And my colleague was telling me that he had a patient who called in and he called in a prescription, but he didn't have a chart. So he didn't realize that she was allergic to penicillin and he's calling it amoxicillin. Luckily, the pharmacist picked it up and stopped it. Otherwise, she would have got a major reaction. But if you have your chart in front of you, that cannot happen. So what is the advantage of MyChart? Nothing gets missed. You send a medical message, it sits there. There's a date and time stamp, and I can easily trace it, so it cannot get lost. You could upload pictures or videos confidentially to me to see. Now, suppose if you have a little bit of a boil you're concerned about at the vulva, you're wondering, what is this? You take a picture, put it up, and I can look at it. I can respond to your query without connecting with you, especially if your message is nice and detailed. The most important thing is while I'm looking at your message, I'm in your chart and can see my previous notes, the previous messages, your medications, your allergies, everything I can see right there. That is why my chart is safer. Now, people will think, oh no, it is in the ether. How is it safer? Well, it is much safer than a phone call. You're calling someone, you never know who's sitting next to the person receiving the phone. You don't even know if anybody third party is listening on to the call. So information sent by my chart is confidential. Phone is not. It allows patients to send in pictures explaining what she's talking about. It's a quicker response because what we have done in our practice is that we will respond to our My Chart messages within the hour. I cannot do that if I'm seeing patients, but in the clinic, I can log in or someone's logged in and they can look at that message. But if it's a phone, it's at a different place in my office. It's hard to get to. And all information is right there in your medical chart. That's the key. So our policy, as I mentioned to you, is we are making sure that all our patients get onto my chart. It is for your safety that you need to get onto my chart. It is to avoid these errors that I mentioned to you. Phone calls, I'm telling you, when I'm in your note, I have everything in front of me and I feel very comfortable. On a phone call or someone is relaying me a story, it's not the same. We respond very promptly. I told you, within the hour, we respond to a My Chart message within the hour. So I could be at a conference. I may have my cell phone with me and I can respond to a My Chart message. I cannot talk to you, but I can respond to a message. So one of our compliance checks is to ensure that all messages are answered promptly within that session and surely by the end of the day. So I'm not even saying within that session. I'm telling you that within the hour, you'll get a response on my chart. We can help you set this up. It's not that difficult. Through my chart, we can send you links, my videos to watch. Let's say you ask me a question and I can tell you, okay, listen, watch this video. I can send you a link and you can watch it and you will know exactly what I'm talking about. Phone, I have to walk you through the whole system and that's very hard to do. For the safety of our patients, we are getting away from these phone messaging. I've had a couple of issues like this, what I talked about, this urinary tract infection and something else. And I don't know, I cannot pin down and say, who do I go after? How do I remedy this process if I don't know where the break is? Because nobody is saying anything. The office says, I don't know who she called. So nobody knows. Patient is also unsure whether she called us or she says, yes, I absolutely called you and I have no trail. But with this, I have an absolute trail. I can say, look, she did call. She wrote the message out. How come we didn't respond to her? So all our future medical messages will have to be delivered via my chart. Of course, if it's an emergency, I mean, that's needless to say. If it's an emergency, you have some bleeding or pain and you want to talk to me right away, you absolutely have to call. But barring an emergency, let's say it's a medication refill, you have some questions about something, you have a slight little urgency or some bladder burning and you want to get that checked out, well, that it's going to be responded in an hour. So absolutely all that can go in my chart. We will help you get there. So please understand the importance of my chart. It is so important for your safety that information is in the system. Not only can I track it, but I can see the trail of messages. I can see your chart and what I've done in the past. I can see your allergies. I can see your medications, and that may have been recently updated. You may have got a new allergy, that you may have even forgotten to tell us. It may not be in our system, but it could be in the chart system. And that is how we can safeguard your health. Thank you.